Welcome to another segment of News Bite on Ghana Talks Radio. My name is Deborah Adoso. In today's news highlight, timing of free dialysis under National Health Insurance Scheme is problematic, Dr. Kwame Asiedu Sarpong stated. Bawumia not running away from the New Patriotic Party's record, Assibey Yeboah. Rising alcohol and drug abuse among health workers, threatening patient care, Ghana Health Service. And our first story for today, a renowned pharmacist, Dr. Kwame Asiedu Sarpong, has expressed concerns about the timing of the free dialysis program under Ghana National Health Insurance Scheme as problematic. This comes after the National Health Insurance Scheme announced a 6-month free dialysis support program for individuals under 18 and over 60 years old with 8 free sessions monthly. While the initiative aims to support vulnerable patients, Dr. Sarpong's concerns highlight the need for a sustainable solution. He notes 90% of Ghana's working population cannot afford dialysis care, emphasizing the urgency for a more comprehensive approach, although 2 billion has been invested in the program.
And that there was no reason why there should be a delay, because delaying was going to lead to loss of life. I did further say that I had not seen any country in the world where renal dialysis was paid for by the patient, because it would definitely bankrupt you. And therefore, it's always funded by insurance. So I'm glad that it's being funded at this point in time. My concern is the timing of the amounts. And I have no question that it's affordable. Let me state that as well, because you need to look at these things from the numbers. And the prevalence rate of renal dialysis requirement in Ghana is about 39 patients per million. So if you look at it, the maximum we can get to is about 1,315 patients a year on renal dialysis, even though end-stage chronic renal failure prevalence rate is about 13%. But those who would be on dialysis, like Dr. Nsiasari has said, which is a stopgap measure, would be only 39 per million people. So if you do the calculation, it comes to about 15,360. Of that, not all of them are accessing service, because unfortunately we have health-seeking behaviors where people would go to other forms of health seeking, sometimes even informal health seeking, like prayer centers and all that, without even knowing that it's chronic renal failure. So there are a lot of them who work. So
moving on to other story, Chairman of the Economic Subcommittee for the New Patriotic Party Manifesto, Dr. Assibey Yeboah, has clarified that the party's presidential candidate is not shying himself from the New Patriotic Party's record in government. Bawumia recently faced criticism after referring to himself as a driver's mate and appealing to Ghanaians to elect him to take full charge of the wheel, which some interpreted as an attempt to separate himself from the current administration's achievements and challenges. However, Dr. Assibey Yeboah, in an interview, emphasized Dr. Mahmoud Bawumia stands fully behind the party's performances. He added that the New Patriotic Party's development initiatives and policy accomplishments have resonated positively with Ghanaians who he believes are eager to retain the New Patriotic Party in power for continuity and progress. And our last story for today, the Ghana Medical Association has sounded the alarm on the rising cases of alcohol and drug abuse among healthcare workers, which poses a significant threat to patient care and professionalism in the health sector. According to the president of the Ghana Medical Association, Dr. Frank Siriboe, he claims the trend is compromising the ability of health professionals to provide safe and attentive care. Dr. Siriboe expressed frustration over the decline in professionalism and growing complacency in healthcare, citing issues such as lateness, absenteeism, poor documentation, and inadequate time devoted to patients. He also highlighted troubling patterns among some healthcare workers who fail to complete a full day work yet expect full pay. The Ghana Medical Association president emphasized the severe impact of substance abuse, on healthcare workers' quality of life and patient care. He reported cases of health workers misusing alcohol and drugs, leading to extreme circumstances and sexual harassment incidents. To address this issue, Dr. Yeboah called for greater accountability, discipline, and renewed commitment to patient care, ethical standards, and rigorous self-regulation among healthcare providers.
We have some health personnel who are involved in alcoholism, drug misuse, and abuse, which affect the quality of their lives. There has been, in extreme circumstances, reported cases of sexual harassment perpetrated by health workers. And yesterday, the Medical and Dental Cancer Registrar, Dr. Divine Bayubala, told us that there are a lot of pending cases of sexual harassment even before the council. We have had cases where doctors have been badly discussed on radio shows and other media outlets. There have been several legal suits against health facilities with the outcomes not being favorable to us as health workers. Indeed, sometimes we are left off the hook simply because the victims of our unprofessionalism choose to blame the witches and the wizards as well as the fearful for their predicament instead of taking on the system. So when we pray, we should pray for the witches and wizards. They are saving us. Ladies and gentlemen, professionalism should be our silent companion. It has to walk with us through our journey of working life. It should always manifest at every opportunity. I know I have painted a grave picture, but let us fortify our spirits against despair with curious agility and also balance our ambitions with acceptance. This will make us truly self-sufficient and grant us eternal freedom.
And that's how we draw curtains for today on News Bites. My name is Deborah Adoso. Do well to log on to www.ghanatalksradio.com for more news updates. Do have a blissful day.